If you want to inhibit the nanoparticle formation, you're using a chelating agent and a reducing agent, which is an antioxidant, and they specified EDTA and ascorbic acid, which is what I've been using in my clinic for 3 years. So what you can see here is, again, you can see the nanobots, you can see the microbots, and you can see the microtechnology. This is when you mix EDTA with vitamin C. It like bombed the holy heck out of the nanobots and microrobots, and there's nothing moving. I'm going to show you a larger magnification here. This right here is just debris field that is left over when the EDTA and the vitamin C come in contact with the COVID vials. There is no activity whatsoever. Here, this is a 2,000 time magnification. There's no blinking, no moving, no nothing. This is a urine metals test after giving 1,500 milligrams of IV EDTA plus vitamin C, as 5,000 vitamin C, and just the amount of metals that are being pulled out. Different groups, like the Argentinian University, have found 54 undeclared metals. And remember that EDTA binds to all of them, as well as inhibits the polymer proliferation, meaning the self-assembly of the nanoparticles. So pulling out the metals pulls out the antenna out of this technology. But what I'm saying is it absolutely works. Here's another example. This was one of my patients who got a tooth pulled and had dental anesthetics for this and developed these rubbery clots, and it just wouldn't stop 3 days in a row, okay? And she was in California at that time, and I just told her, go to your local naturopath, get a EDTA IV with vitamin C. In 30 minutes, it stopped, okay? And you can see these rubbery clots were just coming out, and in 3 days, every few minutes, a new clot was developing, and it just would not stop. And the vitamin C and the EDTA stopped the reaction. General treatment outline for detoxification with this EDTA and vitamin C. So you have to use EDTA in a liposomal, microsomal, enteric-coated, or as a rectal suppository. It's available over the counter. I like Dr. Ed Groups from Global Healing, but there's many different companies who make this, okay? The main thing that you need to watch with EDTA, that you have to replace minerals. So I recommend using the EDTA in the evening and then the multi-mineral supplement in the morning. And then the other thing that needs to be looked at is that people who have chronic kidney disease, the dose has to be adjusted. So I usually use in normal kidney function, maybe around 500 milligrams a day. It's very well tolerated. You can pull out all these heavy metals. You can help with the nanotechnology. And then I use vitamin C up to 10,000 milligrams, obviously titrated to gut tolerance, meaning if people get diarrhea or have problems like that, they would use lower doses. And then for symptomatic people who are like severely vaccine injured or have severe shedding or long COVID issues, I would definitely use IV therapy. So here are solutions for people that they can really do something, not just a little bit. I mean, this stuff totally abolishes the nanotechnology. And I've looked at people, for example, because I have a lot of patients who come to my clinic from out of town who did oral supplementation for 5 months because they couldn't come to see me for an IV, and they did great, and their blood looked excellent on oral supplementation as well.
So the good news is, and I was going to ask you about this and you got there, so great, taking these supplements orally is effective. How about EDTA? What is the oral dosage we should be looking for? And is a pill form good enough, or do you have to get a suppository?
No, so what I wrote here, so around 400 or 500 milligrams. So you were asking if somebody is around vaccinated individuals every single day, then I would use the EDTA every day. But let's say you're just by yourself on the weekends and you're not exposed to anybody, then you can take breaks as well. And then you have to make sure that you're tolerating it, because here's what happens with EDTA. So it floats around in your blood and it grabs all these metals and you pee out the EDTA metal complex. EDTA increases the urine excretion of lead by 4,800%. So literally, you're peeing out all of these metals. And so the oral form is absolutely possible.